And we want to thank you for sticking with K24 this morning. This is what we do every weekday from 6 a.m. all the way till 10 a.m. We absolutely appreciate your feedback that's coming through our social media platforms. Karibu sana to another edition of Health and Wellness with me, Shiko Kaitani. Looking out for you on our Twitter feed. I know Movie told you earlier on that someone has disappeared with our WhatsApp line, rather. Don't listen to anything that Movie says. But what we are doing is focusing on Twitter. So start sending in your feedback or the questions that you may have for our specialists today. The hashtag is K24 this morning so that our team can pick out your tweet so much easier. All right. So that being said, this time around, we are taking a look at fertility health. Well, many Kenyans in dire need of fertility treatment and associated services cannot access them. And this is according to what experts say now. A few who manage to find out where to get these services can hardly afford them. This did emerge at the annual awareness campaign held last week in Nairobi to mark the World Fertility Day 2021. The country's fertility rate was 3.37 children per woman, in a gradual fall from 8.05 children back in 1971. To help us unpack this issue that hasn't been in the limelight for various reasons, we do want to welcome Dr. Vickie Kyengo from St. Bridget Hospital, Kiambu. So it's Kyengo spelled as Kyengo, but it is Kyengo. Welcome so much, Dr. Vickie, to the program.
Thank you so much, Chico.
Okay, so we do have our question of the day before we start engaging Dr. Vickie, and let's put that up on your screen so you can start interacting with us. We ask, do you think that the public is sensitized enough when it comes to matters to do with fertility health? Do you think the public is sensitized enough when it comes to matters to do with fertility health? We'll be looking out for you on Twitter. Should you wish to call, of course, we'd love to hear your voice. Karibu sana. Dr. Vickie, fertility health, also, a bit of a gray area for some. But now we are seeing it becoming, a specialized field more and more. And so help us actually understand what fertility health is as a specialty.
Okay. So fertility in medicine is defined as the ability to conceive or the ability to reproduce for a female species. So when we talk about fertility health or infertility, it's basically awareness of how able are you to conceive. And when a woman does not conceive in a span of 1 year with unprotected sex, that becomes a major concern, and they need to seek medical advice. And that is what we are calling fertility awareness.
Right.
Yes.
Do these matters actually cut across both male and female? Because we see a lot of specialists saying, no, let's just not talk to the woman alone. This involves the male as well.
Yes, it does. Both male and female. Yes, because it takes both to conceive and to reproduce.
Is it true what they say, that there's a lot of research, or should I say findings, that chances are it could be a 50 to 60% chance that it might not even be the woman with the problem?
Yes, actually, male actually contribute 50% of the issues that bring up infertility. So both male and female have to be factored in.
Yeah.
Yes.
It's a very popular topic, by the way, when we tackle this on health and wellness. But World Fertility Day was marked last week. Tell us what the observations were, the research, besides obviously understanding some of the fertility rates, the data that came out. Yes. What more can you tell us, was discovered from last week's event, if you'd call it that?
Yes. So fertility awareness has become more, it's a lot of women especially, not men. Male have shied away from discussing fertility issues, but we have seen more awareness, especially in the ladies who turn up to have checkups, who turn up to have follow-ups and investigations done for their for infertility. And this is good because, I mean, creating awareness by such days is helping at least, for more people to come out and actually realize they have a problem. Some people don't even realize they have it. And more men are also coming up. Nowadays, well, a bit are still shying away, but more are still coming up. We have noted reduction in fertility rates, like you mentioned in the introduction, from the 1970s compared to now. We're in the 21st century. Yeah. So reduction in fertility rates, which can be, of course, contributed to by factors, like our environmental factors, age and technology and so many other things, irradiation, so many things that we've been exposed to now in this new era and age. Yes.
And I suppose even choice could also be part of it, because you know, now more and more women are taking control.
Yes,
Of,
yes,
you know,
their health.
Of their health.
Yes, they are.
Okay, so, but besides the environmental factors that you've talked about,
Yes.
what are you as a specialist actually seeing as one of the major causes of fertility? And you can also, you know, continue to expand on environmental factors, so that now we understand what it could be around us that's causing, you know, the infertility.
Okay. So I can tackle this with starting with female infertility and then male infertility. So major causes of female infertility can be regrouped again into 5 or so factors. Yes.
Yeah.
So we start with the body factors. Yes, which will start with the cervical factors. Cervical factors include cervical stenosis, which is narrowing of the cervical canal.
Yeah.
We have cervical mucus interaction, you know, with the sperm. Sometimes different women have different pH levels that can affect that. Then from the cervix we go to the uterus, the uterine factors. There we have growths, tumors, fibroids, which is a very common cause. Yeah. And then endometritis, or with inflammation of the endometrium, which is the lining, inner lining of the uterus. Then we can group again into tubal factors, which is now the tube, the fallopian tube, yes? Where fertilization takes place. So tubal factors now include blocked tubes, pelvic adhesions, which will block the fallopian tube, causing retention of water, which we call hydrosulfings. All those factors contribute to infertility. And then we have the ovarian factors. Ovarian factors now is where the ovarian hormones come into play. Our follicle stimulating hormones, our luteinizing hormones. When we have hormonal imbalance, especially in a condition we call polycystic ovarian syndrome, what you've had called PCOS.
Yeah.
Yes. So it is actually ovarian ovulation dysfunction, not ovarian ovulation dysfunction. So you find that ovulation does not. The hormones that are controlling ovulation are somewhat imbalanced, yes? And we have women complaining of short ovulation period, cycle, sorry, a long cycle, sometimes missed periods, you know, for over 6 years. A woman will come and tell you, I've not seen my period for 3 months. Then they came and they were really long and heavy.
Yeah, and let me just stop you there, because you brought up a very good point there, and this seems to come out or emerge whenever we are talking about fertility on the show. When you talk about ovulation function or the issues around it, does that mean that there's hope for someone who's actually having this disorder, so to speak? Should they actually wish to have children? Because it's quite common, like you had said. So going forward, for someone who's probably noticing the signs and the symptoms, where you're saying short cycle, long cycle, missed periods for even years, you're seeing the red flags, you know, how would you address that?
Yes, so like I said, it's the most common. Now, ovulation dysfunction is the most common cause of infertility in ladies as we speak.
Yeah.
And then for males is low sperm count, or what we call oligospermia. So for ovulation dysfunction, yes, there is hope for such ladies. We start with medical management.
Yeah.
Yes, which includes giving this lady what we call androgen receptor modulators, which are drugs that will be used to mimic the body's ovulation cycle.
Right.
And that way, we can induce ovulation, make the woman ovulate by day 14, and have a good cycle that now we can facilitate fertilization, or the woman can become fertile and conceive. So there is hope. Mostly now for ovulation dysfunction, we use medical management.
Okay.
Yes.
And the success rate is?
It is good. It is good. I would say over 80%.
Okay, fantastic.
Yes.
Coming to the men who you're talking about, who shy away from fertility issues.
Yes.
So if you've seen, the major issue when it comes to men is the low sperm count.
Yes.
I've had specialists come on the show and say that they actually check. It's not just about the sperm, it's about the quality of the sperm that matters.
Yes.
So in such a situation, how are you able to mitigate the challenge when it comes to men?
Okay, so for men, the test that would actually evaluate the sperm is semen analysis. So you get a sample of the semen, and they look at different things in the semen. We look at the volume, we look at now what you're calling the quality. It's the volume, the pH, the motility, the white blood cell count in the semen. All those factors now give you the semen quality. And if we have low sperm count, which is, you know, or the main cause, will have now difficulties conceiving.
Right.
Yes.
Okay. We do have Dr. Vickie in studio answering some of your questions you may have around fertility. We are focusing on fertility health this time around. Our question of the day still stands. Here it is. We ask you, do you think the public is sensitized enough when it comes to matters to do with fertility health? Remember, we are focusing on Twitter. The hashtag is K24 this morning. And of course, if you'd like to call in and actually speak to Dr. Vickie directly, would be most appreciative. Go ahead and obviously weigh in on our ongoing discussion right here on health and wellness. Okay, so talking about accessing, these services, for people who are having issues with, fertility, Doc. What are you seeing? Very few centers that specialize in fertility health today. What could be the issue in terms of accessing this healthcare?
Fertility initially came under gynecology or obstetrics and gynecology as a specialty. But nowadays it's a subspecialty on its own, like fertility specialty as an OBGYN. You can subspecialize and have fertility specialism. But now we have very few doctors in Kenya who have subspecialized to become fertility specialists. And again, now also most of the centers that we have, level 5 centers, level 4 centers, most of them, when they have these gynecological outpatient clinics, they do not give much emphasis on fertility issues. When a woman will come and complain that they've not had periods for over 6 months, or they've not gotten a baby after 2 years of trying, they'll be referred to another clinic. Some will not even take time and do, the basic investigations before even referring. Well, we don't have many centers in Kenya that have taken up fertility issues, diagnosis and treatment. But the few specialists that we have are doing a good job. Even gynecologists are doing a good job. Medical officers are doing a good job, in the diagnosis. And if we're not able to treat, the few centers that we have in the country can. Yeah. Yes.
Okay. What's the cost implication? Because I think also that's a huge factor to focus on. Yes. We came across a group, if I'm not wrong, back in the day from Thika. Correct me if I'm wrong, probably you've even heard of them, of women who've come together to form a chama to support each other to go for their fertility shots or, sessions, because clearly it's a costly affair.
Yes.
So what can you tell us, Doc, in a nutshell about the kind of costs you're looking at should you actually want to start that fertility investigation to, work your way to getting that bundle of joy?
Yes. So, well, for real, for sure, it is a costly affair. All the way from the basic investigations to the more specialized investigations to even assessing the fertility specialist, and to go ahead and even, going all the way to IVF and treatments, failure, and then, repeating cycles. All that is costly because we're speaking of a cost of about 450,000 Kenyan shillings for one cycle of IVF. So you can imagine if it does not peak after one cycle, that's another 450,000. We've not talked about the doctor's appointments. We've not talked about the reviews fees. We've not talked about
the scans, the
lab works, even your own visit to the hospital is costing you time and money. So all that coupled together will obviously make someone, give up even in the middle. Some will start, yes, very hopeful, very enthusiastic, and then in the middle, finances pose a challenge, and they just go back home and they remain, they stay there.
And they say, this is what God.
This is we just wait on God. Some of them you'll explain to them in clinic. This is what we'll need to do before we can even get to the cause. Just getting to the cause of the infertility itself before even starting to treat it. And they tell you, Doc, I don't have this much money. Let me go and pray. Let me go tell my pastor, and then we'll pray and we wait on God.
That's really tough.
Yeah, it's tough. And then you can imagine, speaking of the financial implication, you're talking about anxiety and depression and stress.
Right.
Every cycle is giving you, it's an emotional roller coaster. Hope, then anxiety, when you're waiting, then oops, there's no baby, depression again.
I was even going to bring that up. Like, what's the psychological effects or at least factors that come into trying to deal with your fertility treatment? The impact of it all on, one's mental health, or their wellness?
Yes, it has a very huge impact.
Yeah.
While it is debatable that stress can cause infertility, it is very evident that infertility will cause stress for sure. So like I said, financial implication is one. Secondly, it's just the drugs that you're using. Yeah, you know, sometimes we'll mix medical and surgical management. Sometimes we'll do expectant and medical management only. And that in itself, the drugs we are using, we're using drugs that will induce hormones or suppress some other hormones. That in itself can cause stress. Yeah, that in itself, the drugs have their own side effects. You know, so you know the drug, we will have to tell you that this drug will cause mood changes. It will cause you to have menopausal signs and symptoms. And so you can imagine that, plus the anxiety of wanting a baby, societal pressure of getting a baby, you know, marital pressure from in-laws, you know. It has even caused marriages to break up, you know.
It really has.
It has.
Would you say a huge arm of what you do is also dedicated to counseling couples? Yes. A lot of counseling has to go in because, you know, even as we investigate and try to find a cause of infertility, there's a lot that has to come into play. You know, sexual dysfunction is one of the causes of infertility. There we have to bring in a sexual therapist, you know. We have to bring in a psychotherapist. We have to bring in psychologists. We have to bring in even religious leaders. Wow,
you know.
It's a whole team.
It's a whole multidisciplinary team, yes.
Wow, okay.
Yes.
You know, there's so much that goes into it clearly that we don't hear about. I want to sample a tweet that my director tells me that we have received. Let's just look at that, then of course continue our chat with Dr. Vickie. Elvis Indy says, I think there are very few specialists, few health facilities offering the service. House to house could be better. Okay, interesting. Doing a door-to-door campaign.
Yes, you know, so many Kenyans have are leaning to home-based care and treatment, especially, you know, after COVID outbreak and everything. People feel more comfortable seeing their patients, their doctors or specialists at home. But that is not possible, especially for subspecialties like fertility. I mean, he has already said that there's few of them available in our country. So for them to even get time to come and see you at home, it will take some time. So most of the time you'll be forced to go and seek advice from hospital, go do your investigations from hospital. Again, these are investigations that some are very invasive. So you'd want a whole team to be with you, not do it at home.
You know, speaking about feedback that we get on the show, every time we have touched topics around fertility, infertility, if you will, or reproductive health, Doc, one of the things that really does emerge is that you're seeing younger and younger women seeming to have issues, you know, reproducing. And so you start to look at factors as trauma, you know, to the individual through, you know, procedures like abortions. One doctor actually said a lot of girls are actually causing more damage to their bodies because of the intake of type of drugs. When we talk about emergency pills, for example, what we commonly call P2s. Are you seeing this as perhaps a root cause for infertility in a lot of younger women? Because abortion is big, you know, even if it's not legal, you know, it's happening. We do know, you know, in terms of family planning, what's easier to go for, the emergency pill. So what can you tell us about that?
So among the factors I mentioned, you know, we started the cervical, uterine factors, all that. There's now the environmental factors you wanted me to expound on earlier. So when we speak about those environmental factors, we're speaking about smoking, you know, smoking tobacco, smoking marijuana. All those toxins are accumulating in the body, you know. STIs, you know, sexually transmitted infections, you know, especially gonorrhea and chlamydial infections will go and block those fallopian tubes, and later on you are infertile, and most of them are asymptomatic, meaning you will not have pain, you will not know you're sick, and you have blocked tubes for 10 years, you've never known. So yes, we are seeing younger and younger women present with such symptoms, and we can attribute it to our environment for sure. You know, smoking, our change in diet, our lifestyle choices, you know, and radiation, you know, exposing ourselves to harmful chemicals, all that will obviously contribute. P2, like you said, the emergency pill has been shown, well, it is not a proven scientific finding, but it has been shown to increase the rate of ectopic pregnancies. It has been shown to, yes.
So you start off well, before you know it, it's terminated.
Yes, before you know it, it's that you don't have patent tubes anymore.
I think that's a really good point, because given the day and the age that we're living in, it's high time that we actually start focusing on those environmental factors and what we are possibly doing to ourselves that's causing the infertility. You may not even have, you know, those different health complications, but it really is just through lifestyle choices, like you had mentioned, that could be the reason. And so going forward, just so that, you know, we are on top of the game, we're on top of it, what do specialists actually recommend for more and more women? Is it annual checkups that you drive for? How do I know that I'm healthy reproductive wise, you know?
Yes. When it comes to reproductive health, I think for women below 35 years, we can say annual checkups will do good. You know, we are looking at having regular pap smears. We're looking at having whole body checkup, you know, random blood sugars, you know, blood pressure. Those are vital signs. Just have them checked every 6 months or so. And then we're looking at having a pelvic ultrasound or a pelvic exam done by a specialist every 6 months or so. In case of those signs and symptoms, you know, of infertility, have the workup done early enough so that you can get to the root of the problem and treat it.
Okay.
Yes.
Good point. We're going to take a short commercial break right there, even as Doc continues to encourage more and more women to go in for a checkup, because that's really what will detect, you know, if there's something wrong, like she had said. But most importantly, we want you to continue sending in your questions. Should you have anything in regards to fertility health this morning? Our question of the day is, do you think the public is sensitized enough when it comes to matters to do with fertility health? We'll be talking about some of the misconceptions around fertility, by the way, when we get back with Dr. Vickie. We'll also be sampling some of your feedback that will be streaming into our Twitter platform. The hashtag is K24 this morning. If you want to call in, we'd love to hear from you. Let's take that break.